The first landmark is the first metatarsal cuneiform joint, and you will find that it begins at the first metatarsal, and you work your way down to the base of the first cuneiform bone, and you will find the first metatarsal cuneiform joint. Moving proximally along the medial border, the next large bony prominence is the navicular tubercle, which should be around this area. Immediately proximal to the navicular is the head of the talus, which should be right around here, and when the patient everts their foot, it like sticks out. You can feel it stick out a little bit. So when you move proximally to the distal end of the tibia, you will find the medial malleolus. So if you move downward from the medial malleolus and do a finger width from the medial malleolus, you will find the sustinaculum tali. So the medial tubercle of the talus is barely palpable, but it is immediately posterior to the distal end of the malleolus. So it should be in this general region. So the next landmark is the fifth metatarsal bone, which is this one, and it is on the lateral side of the ball of the foot. So the next landmark is the styloid process of the fifth metatarsal, which is right here, and it's on the lateral side of the head of the fifth metatarsal, and it should be this protrusion. So when you move posteriorly on the lateral side of the fifth metatarsal, you'll find the calcaneus, which is in the back of the foot. The peroneal tubercle is right here on the calcaneus, distal to the lateral malleolus. So the lateral malleolus is right here, and it's at the distal end of the fibula on the lateral side. So the sinus tarsi is right here where my thumb is, and it is in the depression anterior to the lateral malleolus, which is right here.
Alright, for the dome of the talus, you're going to plantar flex and invert the foot, and then you're going to stabilize it, and some of the dome will be palpable, and it'll be like right here. Okay, for the inferior tibiofibular joint, it's going to be proximal to the talus, and you can't really palpate it, but you can put a slight depression on it. Okay, to find the dome of the calcaneus, you're going to begin at the malleoli, and you're going to move plantarward and posteriorly and you're gonna move superior up, and you shall palpate it right here. And you'll find the doma calcaneus right there where my thumb and index finger are. Alright, for the medial tubercle of the calcaneus, it's going to lie on the medial part of the plantar side of the calcaneus, so it'll be right here. So for the sesamoid bones, you're going to palpate longitudinal of the arch until you find the first metatarsal phalangeal joint, and then it'll be right here and you'll feel two small bones. Right, for the metatarsal bones, you're going to put your index finger on the dorsal side and your thumb on the plantar side, and you'll just palpate it, and they should be transverse of the arch of the forefoot. Alright, to find the deltoid ligament, you're going to begin at the medial malleolus, and you're just going to move inferiorly, and you shall find it right there where my thumb is. To find the tibialis posterior tendon, you're going to have the patient plantar flex and invert the foot, and you'll start at the medial malleolus, and you're going to move posteriorly, and you can already feel it right here. There's a pretty good protrusion, and the tendon will wrap around the malleolus like that. For the flexor digitorum longus tendon, it's going to be posterior of the tibialis posterior tendon, and when you have the patient flex their toes, you can see the tendon in action right around there around my thumb. Okay, the flexor hallucis longus tendon can't be palpated unless there's going to be symptoms, but it's going to be on the posterior side of the talus and run along in this general area. The posterior tibial artery is going to be posterior of the flexor digitorum longus tendon, and the patient should have their foot relaxed, and luckily this patient's artery is pretty visible. It has its own little heartbeat, but it's going to be right here.
To palpate the tibial nerve, which is not easily palpable, it's going to be posterior and lateral to the posterior tibial artery, and so it'll be in this region right here. Okay, to palpate the tibialis anterior tendon, I'm going to have the patient dorsiflex their foot and invert, and it should be the most prominent tendon right here. To palpate the extensor hallucis longus tendon, the patient will extend their big toe, and we'll be able to palpate it all along the dorsum of the foot, all the way to the mid shaft of the tibia. Alright, to palpate the extensor digitorum longus tendon, it's going to be just lateral to the extensor hallucis longus tendon, and it's going to cross the ankle right here, and then it's going to divide into 4 different tendons that goes to each of the phalanges. Okay, to palpate the dorsal pedal artery, you're going to find the extensor hallucis longus tendon and the dorsum of the foot, and it's going to lie right in between them. To palpate the anterior talofibular ligament, you're going to find the sinus tarsi first, which is this area right here, and the anterior talofibular ligament will lie right underneath that. To palpate the calcaneofibular ligament, you'll first find the lateral malleolus, and it's going to connect the base of the fibula to the calcaneus. It's going to run plantarward. It's going to be right here. To palpate the posterior talofibular ligament, you're going to first find the posterior edge of the lateral malleolus and the posterior aspect of the talus, and in between there lies the posterior talofibular ligament.
For the perioneus longus, you're going to go from the perional tendon and it's going to branch off plantarward. So it should be in this general direction. For the perioneus brevis tendon, you're going to have the patient plantar flex and evert their foot, and it's going to be more anteriorly of the perioneus longus tendon, and so it should be palpable right here.
Palpate the retrocalcaneal bursa. You will start at the Achilles tendon, right here, and palpate downward until you get to calcaneus right here. And at that point, you'll be pinching the retrocalcaneus bursa. Calcaneal bursa, you'll first find the Achilles tendon, and between the skin and the Achilles tendon, that is where the bursa lies. Palpate the plantar aponeurosis, otherwise known as the plantar fascia. You're going to start at the medial tuberosity of the calcaneus, and it's just going to run all along the plantar side of the foot and splays out to each toe.